Greetings to our science teacher, Teacher Laila, and our fellow classmates. Today, Cheryl, Azra, Sydney, Zoe, and I are going to review on case file number 8, centered around our patient, Roberto Down Sr. and his disease.
Roberto Down Sr. is an 18-year-old college student living in Kuala Lumpur, Malaysia. He is an active and sociable young man involved in various sports activities and student clubs. He is always diligent about his studies and is always eager for new opportunities.
Those parents noticed that he was complaining of a severe headache as well as neck stiffness. He became increasingly sensitive to light and developed a high fever. His parents also observed that he was feeling disorientated and were showing bouts about nausea and vomiting. Because of that, he was immediately rushed to the hospital by his parents as soon as possible. After careful considerations and a few tests including a lumbar puncture test or spinal tap and a blood culture test, the lumbar puncture test came back showing increased white blood cell count and elevated protein levels, which is clearly a sign of meningitis. Other than that, the blood culture test came back positive, which clears our suspicions of him having meningitis.
What is meningitis? Well, meningitis is an inflammation of protective membranes covering the brain and the spinal cord. It is spread through respiratory or throat secretions from carriers. The vectors for meningitis include bacteria, viruses, fungi, or less common parasites. If the treatment is delayed, meningitis can cause seizures and brain swelling. Since meningitis is spread by droplets, we should maintain our self-cleanliness and keep up with our vaccinations to prevent meningitis.
Due to the severity of Roberto's condition, he was immediately admitted to the hospital's intensive care unit, ICU. He was started on intravenous antibiotics to target the bacterial infection and reduce its spread to the brain and surrounding tissue. He was monitored closely for any change in his neurological status.
Thanks to the prompt diagnosis and treatment, Roberto's condition improved over the course of several days. His fever subsided and his headache and neck stiffness gradually resolved. He was moved out from the ICU and into a regular hospital room to induce further recovery.
Finally, that's all from the doctors. Thank you for listening.